Hi everyone, I am Lorianne. I am that gal from Milton, Ontario, Canada, and I am with.
I am that guy. I, I'm Roy Miller from Dallas, Texas, and here's how we see it. Tonight we've got a really special guest. We've got Dr. Dr Pearson. He is a psychiatrist in Dallas in the Methodist Hospital System. And tonight we're going to be talking about anxiety. A lot of people have that issue, so we're going to kind of delve into that a little bit. So Dr. Pearson, if you don't mind, can you just kind of basically give us a view of kind of what anxiety is?
Okay, be happy to. Anxiety is something that we all experience at one point or another. When you're being chased by a great big dog and you're running down the street, you're pretty anxious about getting away from that thing. So your heart beats fast, you're pumping and you're going. Anxiety, in terms of what we often refer to it as, is something where you have that same kind of feeling, but there's nothing chasing you. There's nothing that you can see maybe in your daily life that explains why that feeling is there. And it may come in waves. It may be there kind of as a low level all the time. But that's something that I deal with on a pretty regular basis with people. It's not uncommon at all. And there are many ways of approaching it. Some medication, some therapy. So there's something that usually people who have that bothers them can find something that helps them.
And what would you suggest? Because I know that I've actually a few years ago went through severe anxiety and they wanted to put me on pills. I was on them for a little bit of time, but a lot of us today, we don't want to go that route. So you're talking about therapy. What kind of therapy can help them? And sometimes you don't even know why you're anxious, although I had issues, but today sometimes it happens and I don't know why.
And that's exactly one of the things that happens. Sometimes it happens for no reason at all. In fact, up until, it's been a number of years ago, but we discovered while we were doing sleep studies for people that sometimes people would start being sound asleep, but their heart rate would go up. They start getting sweaty. Their hands might tremble some, and they're sound asleep. And what the researchers did they would let that go on, and then the next night, if that happened, they'd wake them up about halfway through and say, "What's going on?" And the person will wake up and say, "Gee whiz, my heart's racing. I must have been having a terrible nightmare, but I don't remember what it is." Well, what we discovered was that people can spontaneously have full-blown panic attacks dead in their sleep. And if they wake up, they might recognize it. If they don't wake up, they'll never know they had it. And so what that means is that panic attacks can be completely spontaneous for no reason that we know of. And so when that's a problem for people, then it's something that needs to be addressed. Severe panic disorder, severe anxiety can be terribly disabling. Sometimes people get to the point where they cannot leave their home and they become completely housebound, which is terrible. And so, sometimes that's a very real challenge in treating folks like that, is because you can't get them out to go to therapy and to go to treatment. So sometimes that can be, but it's extremely debilitating for some people.
Now, do you find people who have anxieties today, because we have Zooms, because we have a way of reaching out, is there a way to be able to treat that in a better way in regards to therapy online?
There are some online treatments that are starting to be developed, and have been for some time for a lot of disabilities like that. But what we find is that, except sometimes in the most severe cases, if people are willing to make the commitment to do the kind of therapy that does help, some forms of psychotherapy can be just as effective as medications. Cognitive behavioral therapy is one that has been researched and is well known, that can do as well as medications in certainly mild to moderate, and sometimes a little bit more than moderate type of anxiety. When anxiety gets so severe that people can't even go to therapy, then sometimes, at least for a period of time, it's helpful to have medications that do help. And some of our medications are very effective. In fact, some of the medications that we think of as our anti-anxiety medicines, the benzodiazepines, especially like Ativan, Xanax, and things like that, are actually not the best medications for treating anxiety from the medication point of view. There are other medicines that in the longer term actually do a better job. But people who've had those kind of medications, sometimes it's hard to convince them that there are medicines that are better than they are, because they're very effective at immediately relieving anxiety. But sometimes in the long run, they're not as helpful as you think they are.
Well, I have a question. You know, I mean, I know there's just as an idea. So for teens, say teenagers to maybe say 25 or 30, is that becoming more of an issue now than it has in the past? In your experience?
I think in long term, over the last several decades, there may be somewhat of an increase, but that's been fairly constant. In the current climate, with everything that's going on, I think anxiety is being brought out in people whereas they were handling things pretty well before, but with the COVID, having everybody confined and making all the changes that they've had in their life, I think that has really amplified anxiety for quite a number of people. But in terms of teens, that really is probably when anxiety really starts being manifest. Is in late teens, early most 20s is when people become aware of it. Now, often they had it to some degree even when they were younger, but the pressures of going to work or school as they get older sometimes brings that out.
Yeah. So is anxiety a chemical imbalance in the human body that causes it? Because I know that my father only just told me that he used to suffer from anxiety because, being one of those guys, didn't want to tell me. But it wasn't until he was in his 80s that he told me. And I know my mother went through it, but now my sons are going through it. Is it something that is a chemical imbalance?
I like almost might be genetic, doesn't it?
Yeah.
Because it is. There's a very strong genetic component, which means that what is it that's being conveyed from one generation to the next? Is it that just the home environment that conveys it to one generation to the next? Probably not. It's the chemistry that's conveyed, that similarity from one generation to the next that is in some families. There are some families it's not a matter of when that person's or if that person's going to get anxiety. It's a matter of when. So the same thing for depression. Depression also runs in families. Anxiety runs in families. There's a very real genetic component to it. And often I'll be treating someone who has anxiety, and one of the things I always ask about is about family history. And more often than not, they have anxiety in their family background in a fairly close relationship. Brothers, sisters, parents, children, grandparents, in those kind of direct lines. It's very common. And so there is very distinctly if you will, a chemical relationship in that everything that happens in our brain is chemical in one way or another. So of course it's a chemical imbalance. So something's different than people who don't have it. But to say a chemical imbalance kind of oversimplifies what the real mechanism that's going on is. So it's a lot of factors that come into it. Now, there may be people in family that have a significant component of genetic susceptibility that maybe never are put in situations where they have the triggers that start it. Other family members may have a very low threshold for starting it, but it can be quite variable even in one family. But like I said, there are some families that it's so strong and so persistent that it's a matter of when and not if.
Yeah. Well, are bipolar and anxiety, are they linked together, or is that two totally separate issues?
That's a fair question. They're two we recognize them as two separate entities, two separate diagnoses, two separate disorders. But one of the things that just in terms of practical terms of treatment, when I'm treating someone who has a significant bipolar disorder, it is very, very common that they also have an anxiety component to go along with it. And so what it suggests is that those kind of affective disorders, the disorders that have to do with mood and kind of how we look to other people, and that's depression, that's bipolar disorder, and all of the kind of subtypes, there's a relationship with that and with anxiety. And so they have probably a chemical, if you will, connection kind of down below the surface, where we don't recognize it per se, but it's so often when I treat someone with bipolar disorder, I have to treat anxiety at the same time because it can be overwhelming even for them. So there probably is a relationship, yes.
So bipolar, anxiety, and depression, they kind of all interact a little bit, or could?
Well, they're all related. And so I think, chemically, if you will, they're related in some way. Especially between anxiety and depression as well. So they all often occur as a kind of a constellation. You'll have one of those disorders is the main disorder, but some of those others play a lesser part, but are present nonetheless.
Oh, okay, yeah.
So you can have anxiety and not want to get out of bed. But you can also have depression and not want to get out of bed. But there are two different components, I believe.
Right. And well, one of the ways that would manifest would be someone who has severe depression. They don't want to get out of bed because they don't have the energy to get out of bed. They have nothing to look forward to in the day. They're so pessimistic about the world. There's no reason to get out of bed. And besides that, they pull their covers over. They might go to sleep and be relieved. With anxiety, they're afraid to get out of bed because the world's a dangerous place. And sometimes it's hard to convince them that it's not, because sometimes the world is a dangerous place. And so sometimes there's something there to what they're saying. Sometimes it's hard to argue with, but sometimes you say, yes, that's true, but you still have to go on.
Yeah, you have to function in some form, right?
That's right. Yeah,
and this is where, sorry, I was going to say, this is where some people, when I go through my anxieties and I don't want to get out of bed, they're saying, well, you're going through depression. I'm going, no, I'm not going through depression because I have a really optimistic outlook of the world. But in that particular moment,
but the truth is,
could it also be subconscious about something that you're concerned about, worried about, but you just can't put your finger on, and it just causes that?
Well, it doesn't cause it, but I think people who have significant anxiety, especially, well, not only panic disorders, but also generalized anxiety, are often worriers, and they worry about everything, and they worry about things that haven't even happened yet. And so that's one of the characteristics of the anxiety disorders in general is there's an awful lot of worry that goes along with it. Now, in terms of what the example you were using a minute ago of not wanting to get out of bed, sometimes there can be a component of depression that you don't even recognize. And so it can be a little bit of both. So which would not be surprising.
Interesting.
In that when I talked about medications a minute ago, the medicines that when I use medications, and it's pretty often we use them, the better medicines for treating anxiety are actually the same medications that treat depression. And they do actually a better job in the longer term after a couple of months or so. They actually relieve anxiety better than the, quote, anti-anxiety medications such as Ativan, Xanax, clonazepam, things like that. They actually do a better job than they do. Like I said a minute ago, sometimes people who have panic disorder, it's hard to convince them that might be true, because those medicines are so good at relieving the anxiety right now, and they're so grateful to have it, and they're effective. But we'd rather people be on other medications long term than those. So it's a matter of sometimes you have to treat it both ways. Ideally, you also get the people into psychotherapy of some form that goes along with that.
Well, you know, if Lorianne, if you don't mind me using you. So say I'm going to use Lorianne as an example. So if she's starting to recognize that she's getting anxious, you know, that something's triggered her anxiety, you know, what would you say that she might try to do to counter that?
Well, and I hear what you're asking. You're saying, is there something that a person can do short of long-term psychotherapy and medications to try to control the onset of some of these episodes of panic? And sometimes you can. There are relaxation exercises. There are exercises that take on more of a cognitive approach, where they change the thinking that they're having at the time. And sometimes for some people that can be very helpful. And so there are exercises, and there are some things that people can do for themselves that a lot of times can kind of subvert those and keeping them from going to a full-blown panic attack. Part of it is recognizing kind of that they're getting into that situation, and also sometimes recognizing what kind of situations they might be kind of liable to have anxiety in to begin with, because that can happen with some people. Yeah. So yes, there are some things that people can learn to do for themselves, and there are some of the exercises that we've all heard of. There's the slow breathing, the progressive relaxation. All of those things can be very helpful sometimes.
Good.
It's really interesting. I know that there are times where I have strange hours and I actually will go to bed, but my brain just won't stop and my anxiety keeps going, and I got to keep my feet moving like this. But I do have some awareness as to why that anxiety is happening. I have meditation, I do that, and it's still, so you're basically saying probably the best thing for someone, if you can't get past it with meditation, with exercise and such, it might be worthwhile to look into some other options.
Well, if it's not working very well for you, you might try something different.
Yeah.
You know, and one of those differences is psychotherapy with therapists that specialize in anxiety, sometimes with or without medications. The combination, probably when you use medications, probably the best approach is to have the combination of medications along with psychotherapy to help. Sometimes you can find out kind of what the triggers are, either change your approach to those, or sometimes just plain avoiding them. Sometimes that's effective.
Well, you know, one thing Lorianne was saying, like she said, she wants to go to bed, but her brain's just going 100 miles an hour. You know,
it does not turn off.
And so, but she's a very creative person. So, are people that are creative, is that like a common thing for them? In your experience?
Well, anxiety can happen to anybody, whether they're creative or not. Now, the question becomes: is there more anxiety in creative people than the rest of us? I'm not sure. There has been research in some of the affective disorders, especially depression, associating that with creativity. And there is some research that shows that people in general who have depression, if you look at them and their family, there's a higher incidence of creativity than in the general population. And so there's some association with creativity with the affective disorders, depression, bipolar disorder. I'm not aware of that with anxiety, but who knows? It's possible.
Yeah. That's pretty interesting, though. You know, because I would think that like movie stars, singers, those
they're all depressed, aren't they? There seems to be.
Yeah. Now, gee, I only made $5 million on this record. Oh, how depressing.
Right. That's right. I can't afford the rent next month.
That's right.
I just made $5 million. Just another question. So if I have children who are struggling with anxiety, And they, how would you have, I don't know if this is even an answer that you can give me, but they kind of blame me for it.
Well, don't kids blame their parents for everything? So it goes along with it.
But how do you go through it if you see one of the children taking it to the point where it becomes dilapidating for them, like it's causing them to go through things, but they refuse help? There's no way, I'm not doing this. I know I have anxiety, but I'm not going to be. Is there a method?
Sometimes you use your best persuasiveness. You tell them that, yeah, it is your fault because it's your parents' fault. Blame them. But the reality is if someone just refuses to acknowledge that that's an issue that needs to be addressed, there's not a whole lot you can do. And when they get to the point where it's so much of a problem for them that they're willing to look at it, that's when you can maybe help them. But until then, they're going to have to just figure it out for themselves.
You can't do one of those, what do they call them when you come in and you have the
Intervention. Intervention.
Don't know that would work very well.
Just an ask. Just
really make them mad at you.
The anxiety intervention team is coming.
That's right.
It's tough to watch though.
Ghostbusters have anxiety busters.
That's right. I've had patients who, and the other thing about anxiety that a lot of people don't realize is it can be kind of cyclical. There's some people who will have episodes of severe, often it's panic disorder and agoraphobia, which is a very severe form of anxiety where they just hardly can get out of their house. That may come every several years, and then last for 6 months, a year and a half, 2 years, and then it wanes and goes away for several years. I've had several patients that I've been in practice long enough. I've been in practice for about over 31 years, that I've seen several people who've gone through a number of cycles where I help them with the anxiety and they get better. And they go off and they live their life and they go back to their job and they do it, and that may last for 5 or 6 years, and then it comes back again. So it can kind of wax and wane over a period of a number of years. So that's not an uncommon pattern also.
So here's a question, because when I had my severe anxiety, it was back in 2011. And literally it was exactly what you were saying. I didn't want to leave the house. Even my parents would come and try and get me out of the house. And I was even anxious about going with them in their car to go to wherever it was a comfortable place.
They were trying to do an intervention.
They were. And I did that, but it was really nerve-wracking for me every time I got out of the house. And then I was fine. But I find that I'm having a little bit of that because of the COVID, because I was here for 4 months in my home, and I'm kind of an introvert anyway, introvert extrovert, but I love my home. And so to go back out there in that world, and I said to someone, I said, it's not even about the COVID anymore, it's about the people.
Yeah, and that's kind of that anxiety. Now, probably for people who are very introverted and prefer to stay at home, this COVID sheltering at home has probably been just fine with them. That's not a problem. But for people who really are extroverted, like to get out, and for the most part, people really are a gregarious animal. We need to be around people, but the vast majority of us do anyway. And not being around and associated with the people that we know and love, it's hard on folks, and so that also can contribute to the anxiety as well. So it all and depression. So it all goes together.
Interesting.
Well, that's. Do you have anything else, Lorianne?
I have one final question on this. Do you find, would you know, because I have pets, and I have to say that my pets they relieve my anxiety quite often. And of course, if I'm lying in bed for too long, they bug me and jump on top of me. They're all excited. And it's like, okay, I'm getting up now, because they're always loving and caring. Would you consider that to be helpful for people who have anxiety? I'm not saying, hey, people who have anxiety, go get a pet, but would you feel that people who do have anxiety and have pets, that would be something that helps them?
A lot of people find that pets are very helpful for anxiety as well as in a number of other conditions. If you've ever done any reading about the pets in nursing homes, they find that people who are with the pets, their heart rate goes down, their blood pressure goes down. It really comforts and relieves. And people who have pets, they have somebody that they have to take care of. They have somebody that outside of themselves that are important to them, that they can then take care of. And that being able to help, even if it's a dog or a cat, can be very therapeutic as well. And so that's not a bad thing. Not a bad thing at all.
Cool.
Right.
Yeah. So it gives them purpose.
That's exactly right.
Yeah.
Gets them out. They have to.
Well, Dr.
That's
Pearson,
wonderful. I really appreciate this.
yeah, I really appreciate you coming on. It's, I've enjoyed it, and I've learned a lot. I don't know about everybody else, but I did.
It's been a real pleasure to be able to join both of you, and this is a neat medium. I hope more people are using it.
Yeah.
Thank you so
we may
much.
have you come back on again for something else.
I'd be happy to. Be happy to anytime. Lori,
Excellent.
nice meeting you.
Okay.
Nice meeting you. Thank you so much for your time, Dr.
Yeah.
Pearson. I really appreciate it. And lovely to meet you.
Yeah.
Good to meet you.
All right, Dr. Pearson, thanks a lot.
Bye-bye.
Bye.
Bye.